We know diabetes and high blood pressure are big risk factors when it comes to many diseases. But did you know that they can actually impact your kidney health? Bridget is now standing by to talk to a doctor.
Kidney disease is something we've all heard of, but what do you know about keeping your kidneys healthy? It turns out reducing your risk of diabetes and high blood pressure is one of the ways. That's why we have Dr. Mustafa Kinaan here, and he's an endocrinologist with HCA Florida Osceola Health. Thanks for taking some time out to stop by.
Thank you. It's a pleasure.
When we think about kidney health and overall function of kidneys, it's tied into everything, and it's filtering lots of things in our body.
Correct. The kidneys are very important organs in our body, and they do several functions like filtering any toxins and byproducts from our metabolism and cellular functions. And they also regulate our blood pressure and our electrolytes like sodium, potassium, calcium, and several other functions. So they are definitely very important for our general health.
And so kidney disease is any time you start having a malfunction there, but it includes many things.
Correct. A lot of illnesses can cause issues with the kidneys, and they're usually very subtle, and they start progressing over the years. But when kidney disease gets to a severe point or to an end-stage renal disease, a lot of these important functions are lost, and it's important to prevent that from happening so we can save people from having to go on dialysis or suffer consequences of that condition.
And what are, some of the ways that high blood pressure and diabetes tie into our kidney health?
The kidneys are very vascular, organs. They contain a lot of blood vessels, and diabetes, high blood sugar, and hypertension, they damage these blood vessels. So they affect the filtering properties of the kidneys, and slowly and gradually over the years can cause chronic kidney disease.
And what are some of the misconceptions around those conditions, and taking care of our health?
So a lot of the time people are not aware of how prevalent kidney disease is. So diabetes and hypertension are the two most common causes of chronic kidney disease. And 1 in 2 adults in the United States will have hypertension during their lifetime. And the prevalence of diabetes is estimated to be 1 out of 10 adults in the United States. A third of diabetic patients have chronic kidney disease. So it is a very prevalent problem, and a lot of people don't know that they have that condition until it's too late. So it's very important to be proactive about screening and checking for diabetes, high blood pressure, and chronic kidney disease.
Really, what can we do to look out for signs and symptoms? Because you said it a lot of times has gotten progressively worse before people really take action. So what should we be looking out for in terms of, there might be a problem or I might need to make some changes?
Well, it starts even in healthy people. It's important to live a healthy lifestyle, having a healthy diet with less salt, less processed foods, and less sugars to prevent problems like diabetes and hypertension. It is also important to keep up with your physicals and to see a doctor routinely, especially if you have history or family history of these conditions. It is important to check for diabetes and high blood pressure on every few months or once a year at least with your primary care doctor. And if you have one of these conditions, it's important to closely follow up with your endocrinologist, nephrologist, or your primary care doctor to take all measures necessary to control your hypertension and diabetes. People just need to be proactive about screening and looking for these conditions because more often than not, there are no symptoms that happen with chronic kidney disease until it's too late.
And living with kidney disease is manageable if need be, but the key is to keep it from getting into other conditions building on top of that.
Correct. A lot of patients who have chronic kidney disease live normal lives if they are following up with physicians. There are some medications and measures that we can do to help reduce the symptoms of chronic kidney disease. But the key point is not to get it to the point where they need to go on dialysis. So it's all about prevention.
Right, that ounce of prevention worth more than a pound of cure.
Absolutely.
All right. Thank you,
Absolutely.
Dr. Kinaan, for
My
coming
pleasure.
in.
Thank you.